Hi guys, welcome back to my channel. I hope you guys are doing well. Today's video is going to be about the least competitive and easiest specialty training programs in the UK. Specialty training program is what doctors here do to specialize. It is similar to a residency program in other countries. I do have a separate video on the most competitive specialty training programs, so do check out that video as well. This video will be based on the competition ratio for these specialties over the last few years, the duration of the training program, the pass rate of the specialty exams, and the number of consultant jobs available after completing the training program. The least competitive specialty to get into is general practice or GP. GP is similar to family medicine in other countries. There is a huge demand for GPs throughout the UK, so it is relatively easy to get a job as a GP once you have qualified. GPs work in community clinics as part of the primary healthcare service. GPs will see a wide range of cases from all specialties. They will see and assess all cases. If the patient needs a more specialist input or a specialist treatment, the GP will then refer the patient to a specialist at the hospital under secondary care. GP also has the shortest training program in the UK. The GP training program is 3 years in total after FY2. Most other specialty training programs are 7 years in total after FY2. GPs have to sit for the MRCGP during the training program. The MRCGP consists of 2 parts, the Applied Knowledge Test or AKT and the Clinical Skills Assessment or CSA. The AKT is a computer-based exam consisting of 200 questions over 3 hours. Most of the candidates who have sat for the exam said that it was relatively easy. The AKT has a mean pass rate of 77 for first-time candidates, which is actually quite high compared to other specialty exams. The CSA is like an OSCE, consisting of 13 10-minute consultation stations. The pass rate for candidates taking the exam for the first time is around 75%. The next specialty that is relatively easy to enter is Paediatrics. The competition ratio for pediatric training last year was 1.18. Pediatric trainees need to sit for the MRCPCH during ST1 to ST3. The MRCPCH consists of 4 parts: Foundation of Practice or FOP, Theory and Science or TAS, Applied Knowledge in Practice or AKP, and MRCPCH Clinical Exam. The FOP, TAS, and AKP are all written exams. The MRCPCH Clinical Exam is similar to an OSCE. It is a 12-circuit station OSCE. The MRCPCH is a tough exam. The pass mark for the written exams is usually between 62 to 65%. The next specialty that is relatively easy to get into is psychiatry. You first need to apply for core psychiatry training, then you have to apply for higher psychiatry training in your desired field. The competition ratio to enter core psychiatry training is 1.72. The competition ratio to enter higher psychiatry training is also relatively low compared to higher specialty training in medicine or surgery. For example, general psychiatry ST4 is 0.99, old age psychiatry ST4 is 1.09, and forensic psychiatry ST4 is 1.13. Psychiatry trainees have to sit for the MRCP Psych during core psychiatry training. MRCP Psych consists of 3 parts: Paper A, Paper B, and the Clinical Assessment of Skills and Competencies or CASC. Paper A and B are written exams, while the format for the CASC is like an OSCE. The MRCP Psych is not easy. The exams are challenging and you need to have an in-depth knowledge in psychiatry in order to pass the exams. Last year, the overall pass rate for the CASC exam was only 52.5%, so it is a relatively tough specialty exam. That is all of my video today. I will try and do a separate video on the least competitive higher medical specialties, so do look out for that. If you like this video, please give it a thumbs up, subscribe to my channel for more videos, and I'll see you in my next one. Bye!